Greetings from Citizen Health Team under Academy IAPSME Connect. And in the series of People's Health, It Matters, today we have Dr. Venkat. Welcome you, sir.
Thank you so much.
Today we are going to talk on efficacy. What is efficacy? Nowadays we are everywhere talking about vaccines, COVID-19 vaccines, and this much efficacious that vaccine is, this much efficacious that vaccine is. Now Dr. Venkat will tell us that what is efficacy and how it will matter. Let me introduce Dr. Venkat. Dr. Venkat is a professor of community medicine, IMS, and some hospitals, Shiksha or Anusandhan teams to the university. And I would like to welcome you, sir, on behalf of all the audience
Namaskar.
in this series. I would like to start the session with a question that in the battle against COVID, an effective vaccine is one of the prominent arsenal. However, there are several vaccines available today. In due course, they will come to the market. Should we be concerned about the efficacy of the vaccine before choosing one?
Thank you so much. Now, you have used two words. The question what you have asked is efficacy, and there is another word called effectiveness. Most often, we think that efficacy and effectiveness are one and the same. Unfortunately, they are not. Efficacy is the term which is being used very quite often nowadays in the market. When this J&J vaccine came, Johnson & Johnson vaccine came, it for the first time it said that 66% efficacy. At the same time, there were two other vaccines which came, that is by Moderna and Pfizer, and one of them is 95% efficacy and the other one is 94% efficacy. Now, common sense tells, when you go to a vaccination center and you are being offered three vaccines. So we have COVID vaccine by Moderna, we have COVID vaccine by J&J and by Pfizer. What will come to your mind? Instantly, you will start thinking that, okay, what is the difference between these three vaccines? Okay, the efficacy of J&J vaccine is 66%, and other two is one is 94 and the other one is 99, 95%. And common sense will tell that, okay, let me go for the higher efficacy vaccine. Unfortunately, these numbers do not translate into what exactly you are wishing for. What are you wishing for? The vaccines are made to protect you from the disease. And efficacy is a term how it has been developed. Through clinical trials, I'll tell you in brief. What are clinical trials? Clinical trials are controlled conditions. In controlled conditions, the vaccines are tested. First on animals, then in a small group of subjects, what we call it as phase 1 study, then in a little larger group where there is age. Initially, if the age group is 18 to 55, then in the phase 2, we will increase to 12 to 65. Then it comes to phase 3, phase 1 and 2, we are looking at normal people, absolutely healthy. But in phase 3, we will start recruiting few more subjects like someone is having diabetes or hypertension, and we will try to give the vaccine. Now, in phase 3, what we do is we take a huge number of subjects. Maybe in case of Covaxin, you might have heard, it's 25,800 subjects were recruited. And this is supposed to be the largest clinical trial in the country. And what we did, half of them we gave the vaccine and other half we gave placebo. Placebo means just for the name's sake, it is a vaccine, but it is blinded. Neither the recipient nor the person, the provider, none of them, they know who got a placebo, who got a vaccine. Then what we do? All those people are living, I mean, they are allowed to live their normal life. Because the COVID is being transmitted in the community, everyone has got a risk of contracting the disease. So people, they start, few of them, they start contracting the disease. We do not know who has received the vaccine and who has received the placebo. But as and when somebody comes to us, we test for COVID virus through RT-PCR testing. And we see that how many of them are positive. Now, this Pfizer vaccine, for example, that is supposed to be world's largest trial, because the Covaxin trial is still going on. Even though the results are out, it's still going on. But the Pfizer vaccine has completed. They recruited 43,000 subjects. Half of them, they got the vaccine, half of them, they got the placebo. And from among them, they started counting how many of them got positive. 170 people were positive. Now, after testing for whether they are positive, or I mean, how many of them are positive, then they started unblinding. How many of them had received a placebo and how many of them received a vaccine. Our common sense tells if the vaccine is effective, okay, let me not use the word effective because I'll reserve it till the end. If the vaccine is working, that means people, those who have received the vaccine, should have contracted the disease less, and those who have not received the vaccine should have contracted the disease more. And if all the 170 subjects are lying in the placebo group, that means the vaccine is 100% working. All those who received the vaccine, none of them, they got the disease. If all the 170 would have been on the vaccine group, there is no calculation. If 50% on this side and 50% on this side, then we calculate as 0% working. I repeat this, don't get confused. All the 170 in the placebo group, the vaccine is working 100%. If 50-50 on either side, that means there is no difference between the vaccine and the control. But if all the 170 would have been in the vaccine group, there is no calculation. Now I will tell you what is efficacy. Efficacy is comparing between how many people in both the groups are contracting the disease. In case of Pfizer, only 8 subjects were in the vaccine group and remaining 163 subjects in the control group. And how did we calculate the efficacy? How much of excess risk in the placebo group? That means 170 minus 7 divided by 170 into 100. This is the percentage of excess risk in the placebo group. This is the term called efficacy. And Pfizer vaccine came up with 95% efficacy. That means those who have received the vaccine, they are 95% times lesser risk as compared to no vaccination. That does not mean that if 100 people are vaccinated, 5 people will contract the disease and 95 people will not. No. You got my point? Let me repeat last time is if the vaccine is 95% efficacy, that means it is applies to an individual. if I have taken the vaccine, my ability or the risk of contracting the disease is less than the other person. 95% less. Now, two more things are there. I'll tell one after the other. Okay. Now, do you have any question at this junction?
No, sir, no, sir. I am really finding it interesting.
Okay. Okay. Now, let me come to the second point. Third point also, I have 3 points only for total discussion. Now, you may say that J&J vaccine, which is having 66% efficacy, that means if I have received J&J vaccine, that is, I am 66% lesser risk compared to those who have not received the vaccine. Oh, okay, let me go for 95%, not 66%. This is my common sense. You may say that, but again, this is my second point. If you think like that, again, this is wrong for the reason that these vaccines are tested in different populations and different time points. Now, for example, Pfizer vaccine and Moderna vaccine were tested in US between the first wave and the second wave. On the contrary, this J&J vaccine was tested towards the beginning of second wave and it continued throughout the second wave, where the chances of contracting the disease was higher. Now, if you compare Pfizer vaccine and J&J, the chances of contracting, because the different time periods, more number of cases are occurring. Number two, this J&J vaccine was tested simultaneously in South Africa and Brazil. In South Africa and Brazil, the dominant strain was a different strain, beta strain. Despite of different time period, despite of different strain, still it could succeed in controlling 66% protection. What does it mean? So that means the 95% of US trial or 66% of US, Brazil and South Africa, where the dominant strain is different. Which is better? My option would be I will go for J&J vaccine, even though it is 66%. But the second point, I will conclude by saying that, then how do you decide? If J&J vaccine as well as Pfizer vaccine or Moderna vaccine would have been tried at the same time, same population, same controlled conditions. Again and again, I'm using this term controlled condition. The third point, I'll discuss why this controlled condition. If I would have compared these two vaccines at the same time, same population, same controlled conditions, then if I would have got 66 and 95, I would have comfortably gone for higher number. Okay. Now, before I move on to the third point, let me explain. In the first point, I said that if 95% efficacy means a person is 95% lesser risk of contracting the disease. To whom this efficacy numbers are important? Not to the individual, it is for the health system. Think of Government of India. He has rolled out crores of money. Indian government has rolled out crores of money for control of the disease. If a vaccine is less efficacy, then a lot of money pumped in will go into waste. So they decide that if any vaccine which is more than 50% efficacy is a good vaccine. And 66%, yes, it is good. 95%, good. 94%, good. If Covaxin, if you talk 78%, yes, it is good. Then coming to the final point. This is the point what I would like to emphasize, that is effectiveness. So far we were discussing is efficacy in
Efficacy.
controlled conditions. Controlled conditions in that sense, in the clinical trials, we handpick the number of subjects, very limited subjects. Okay, you have kidney condition, you are ruled out. You have this condition, you are included. You have this age, ruled out. You have pregnancy, ruled out. Child, ruled out. So many controlled conditions. When the same vaccine which is rolled out into the program, like right now Covaxin, Covishield, Sputnik V is being rolled out in the country, in our country. Now, in that case, how many of them who are contracting the disease in the field condition, not in a controlled condition? Clinical trials, what we conduct is very controlled conditions. Then the ability of the vaccine to protect you from contracting the disease is called effectiveness. That is the real acid test. Once the vaccine is rolled out into the community, into the public health program, then how effectively it is preventing you. That is called effectiveness. So efficacy is a trial thing, which is the numbers are important for us researchers. Effectiveness, if you get this word against any vaccine, yes, you have the option to choose, okay, I will take this vaccine, not that vaccine. Okay. Now, I think I have finished my discussion. If you have any further questions, I'll be more than happy to answer.
Sure, sure, sir. Actually, as a common person, as a layman, I would like to ask that when we go for a vaccination or when we see the details of any vaccine like Covaxin, Covishield, JJ, any vaccine, we just simply see that how much efficacy, how much effective it is, and more of the times
No,
effectiveness is
no,
not given.
absolutely. Effectiveness is
Effect
never
not
mentioned.
never
Effic-
mentioned, not
and,
given.
and efficacy is not a number for you to use. I will, at this
Then
junction, I will add one more point. See, in this all these trials, including our Covaxin trial, also I was a principal investigator for our site, and all these trials, all those people who have contracted the disease means what? Now, there are at least five stages of the disease. That
okay.
means I am absolutely asymptomatic, but if you use my throat for examination, you will get RT-PCR positive. There could be mild symptom, there could be moderate symptom, there could be severe symptom, there could be hospitalization and death. What we do is in efficacy is to look for hospitalization, no, I mean death, yes, hospitalization, yes. What about moderate disease, mild disease, asymptomatic disease? Yes, we look for, but all those numbers are not released. Initial numbers, what it came is just RT-PCR positive. In our Covaxin trial, 78% efficacy is for RT-PCR positive. Then, if at all you are looking for efficacy, you should look for efficacy of the vaccine in preventing death and severe disease. All these vaccines, almost all of these vaccines are near to 100%. Near to 100% are Covaxin, J&J, even though 66, but preventing hospitalization and death is close to 100%, more than 95%. In India, Chennai, one of the study, I am not able to recollect, in Chennai, they conducted among the police personnel and they calculated the effectiveness. And they have seen that both Covishield and Covaxin are close to, I mean, more than 95%. So that means any vaccine you get, don't miss that opportunity. You use that vaccine and you are protected against death, that is very important, hospitalization,
Hospitalization.
and moderate disease. Okay? Yeah. Any more questions?
Right. That was only my question. That being a layperson, should I do the proper research that how efficacy has been done, studied, or should I go blindly and get any vaccine, whatever is available to me?
As a researcher, my advice is scientific advice that go for the vaccine whichever is available. Let us suppose the vaccine is expensive. Like, for example, Covaxin is in the market, it is around 1400 some plus. It's being
Hmm.
sold also, and Covishield is around 800 rupees. So that means, okay, you can choose cheaper one, doesn't matter, no issues. Covishield you can go for, and don't go by hearsay. Trust the words of the researchers what we are speaking, because we have studied thoroughly. Every vaccine is good. All the vaccines which are rolled out in India, like Covaxin, Covishield, and Sputnik V, all these things are after several testing, very rigorous testing. We have been giving the instructions.
Thank you so much, sir. Thank you. You have told this so interestingly that I didn't find that we have spent this much time.
Okay.
It was so interesting and so informative session with you. Thank you so much.
Thank you so much.